Hey everybody, welcome back. This is our second video in the On Trail or Just Out and About self-care video series. So today we're going to focus on the general shoulder, but as well as some options from the shoulder down to the hand, and they kind of go together. So the initial repetitive disclaimer first is that in the description box below will be a link to the boilerplate video to discuss the full disclaimers, which really are important. Please go there first. This matters, as well as more about who I am, what I do, and how this stuff works, since the vast majority of you won't be familiar with it, and I just don't want to take the time to explain in every video because it takes a few. Otherwise, the main repetitive disclaimer is that I don't know if this is appropriate for you. It could be inappropriate for you and be a bad idea. For most people, it will probably be fine, and for most people, if you're having pain or issues from here down to your hand, this ends up helping most of the people I work with. But the biggest caveat with that is if you have an injury, if you suspect an injury, don't try this. Go to a practitioner, get it checked out, go from there. So again, go watch the boilerplate video. Disclaimer's done and handled. Let's move forward. So it's going to be the same protocol as with the previous and the future videos, which we'll remind you about in a minute. So when it comes to if you're having some general shoulder issues, less head neck, but more shoulder itself, and kind of upper back, just kind of this whole region itself, the homework is going to be fairly simple. What I have you work on is just under the collarbone, just inside from the shoulder joint itself. There's a couple ligaments called the corticoclavicular and the coracoacromial ligaments that we're going to have you work on. And so it really is just underneath the collarbone, just underneath it, and just in from that shoulder socket. And underneath right here is a bony knob called the coracoid process. Some people it's really big and move forward, so it's really prominent. Others it's more recessed, and so it's a little hard to find, especially if you don't really know what you're looking for. But the simple bit is under the collarbone, just in from the shoulder joint. You're gonna work around that bony knob a bit for about an inch, maybe two, just to be thorough. So for the ease of the visual, that right there, those two groups is what we're working for. So that's the actual shoulder joint. As you can see, that's out at the end of, let's basically say, your collarbone, and just inside, this is about maybe 1.5 to 2 inch width right there, depending on the person. There's that bony knob and those ligaments. So as with all of the homework we'll end up discussing, we want it to be light contact only. You're not digging in there. If a 3 out of 10 was some real discomfort and 4 is where pain started, it's like 3.5, 4.5 is fine, more is not. One thing that isn't surprising with this is that you do have a big nerve branch, the brachial plexus, that comes down underneath your collarbone and is going through some of these areas to spread out and supply the arm. Normally you should be able to push modestly in a nerve and not have it actually come to any symptoms. It has enough stretch that it shouldn't be a problem. It's just when you really hit it that it's normally a problem. But if things are really restricted and you push on it or push on things around it, it may cause a stretch that will give you a little bit of tingling or a numbness down the hand if you're really close to that threshold, or that's why you're doing this in the first place. It's not necessarily a problem or something to worry about. But if you're pushing in an area that gives you those sensations, just go a little bit more gently. That should be in from here, but again, if things are really inflamed and restricted, even pushing on things around the area, not on the nerve at all, can cause a little bit of tugging and cause some of those nerve sensations. So don't worry about that, just be cautious with it. And again, the rest is pretty light pressure throughout that. So I want someone to take about a minute or so working on this around that kind of outside side of the coracoid process and up through here. This one is one that can kind of intimidate people to start with, but it really is pretty simple, and just under the collarbone out towards the end, nice and gentle. The exercises to follow it are also pretty simple. First one is just, I don't want you to reach with the shoulder, I want it kind of in a neutral position, but you're literally just going to do some arm raises. First moment there's fatigue at all, stop. And I can't oversay this enough. It's not weightlifting, running kind of fatigue. It's just, oh, I couldn't do that forever. This is a little tired. Stop. If you have an issue in the area, it's usually 1 to 4 tops. If you get to 5 in the beginning and you don't feel fatigue, stop anyway. The other one, we have 2 options. My preference is you're going to turn your arm all the way in, have it up alongside your head, and you'd be laying face up and gently pushing that into your head. Make sure you're not pushing your head into that. It needs to be arm into here, and without reaching too much. On off, you get fatigue, you stop. If you get to 5 and you feel no fatigue, stop anyway. If you can't get that full range of motion, you just don't have it, what you do is you'll rotate it all the way in. You will reach the shoulder out a bit. You're going to hold it across your chest a bit, and you're going to push those 2 together. Just hold for a second or 2, let go, repeat until there's fatigue. You get to 5, stop anyway. If you're a week or 2 into this and you could go to 10, but it really is, that initial fatigue point is so important. If you go past it, it's not going to work, and it will make things worse depending on how much over you're doing it. So really, you don't get extra points for continuing past that. So those are the shoulder bits, but I'm going to kind of add a couple extra things, which is, especially if this doesn't seem to resolve the issue, I'm going to have you do the neck and head video with an extra. Which means do the head and neck video, do this one, but after those 2, I'd have you, so you just say done this part from the head and neck video. I won't go over that now, but you're doing the releases from the head and neck video. I'd have you lean off onto your side, say if you were laying on the ground and laying on a shoulder like this, so you're at this angle, you'd go through this range, taking the head off to the side, and squeezing the shoulder, but you have to be leaning away from it, otherwise it doesn't work. Again, first fatigue, stop. So, moving on to basically elbow down through hands. I'm going to keep it fairly simple-ish. This may not seem simple to me, this is a little bit of a reduced version. I'm going to have you lightly rub the pad of the thumb. Lightly and broadly, we don't want you to jab into this, but the last 2 inches below the wrist or above the wrist, depending on how you want to speak about it, but gently working through that with a thumb. Just really broadly, because there are nerves and vascular bundles in here, and we don't want to jam in those. It's not going to help, but just broadly. And lastly, kind of rub around the wrist joint itself, just like gently with, say, a thumb along all sides. Again, being gentle around here because you do have nerves and arteries and veins and all those lovely things. And so taking about a good 1.5 minutes or so, maybe 2 between all those structures, and what you're going to do is hold your pinky and thumb together gently, and I'm just holding this up here for the example. I'd actually have it kind of down here. I'd have you turn your palm face up, let it relax to go back down. I don't want you to turn it down, I want you to relax it. So up, let it flop down. Up, flop down. If the hand gets tired first, let that go. If the forearm gets tired first, just be doing this part. Whichever one tires first, stop it and keep going. And same protocol as everything else, which is that whole first fatigue, etc., that we just said a few times. And this is a 3 to 4 times a day thing for most people. If you guys are on the trail, this will probably be less, there'll be less load on this when it comes to, like, say, compared to your feet, ankles, etc. So 3 to 4 times a day will probably be plenty enough for you guys as well. Whereas with anything from the toes up to the hips is really kind of every time you take a break situation. But if it's really aggressive, every time you stop for water to rest your feet or something, take a few minutes and do this one too. Excuse the hiccups. So that's really it when it comes to hands all the way up to shoulder options. Again, there's certainly other things that can be needed. This is just the safest but broadest, deals with most of the issues on a superficial, symptom-only level. Well, not just symptoms, it helps with symptoms by getting stability improved, by getting function better. It's just not dealing with those deep issues that caused that to not be the case in the first place. So this might not be appropriate for you, it might not help, but it's something to give a try. And again, to be repetitive, if you suspect an injury, don't do this, get it checked out. It's normal to have a little bit of weird symptoms come and go, to have what you work on feel more bruised for a few days, because even with light pressure, you're pushing on something and pushing on it repetitively. And if you don't feel it being notably better in a week, this homework wasn't really for you in your situation. If you feel it get markedly worse in the first several days, then don't do it either. If you have questions, let me know, but also a couple months and I will be out there through hiking and won't be able to really answer, so I'll do my best. So more videos will be coming. In the next few days, we'll be working on everything from the plantar fasciitis, shin splints, IT band stuff, as well as back pain, hip pain, and some other stuff in the region. So we're going to try to be pretty full joint / region by region, so that whatever comes up, we can give you something that should, for most of you, be able to help. You may have noticed the costume change. I had a video disappear. So as it is, there's more coming out. So if you liked, comment, like, subscribe, etc. There'll be more. And again, if you have any questions, let me know, and we'll see you in the next video.